Good evening and welcome to everyone. I'm Chris Ray, and I'm going to call the September 29th City Council study session to order. Before we move to tonight's agenda, I'd like to acknowledge our remote meeting format. On March 6th, the mayor issued the emergency proclamation declaring a civil emergency in the city due to the COVID-19 outbreak. On March 24th, the governor issued Proclamation 20-28 prohibiting meetings that fall under the Open Public Meetings Act. The proclamation has been extended through October 1st. Tonight's meeting will be held entirely remotely. The meeting will be recorded, streamed live, and available for later viewing on the city's YouTube channel. A call-in number was provided on the meeting agenda for members of the public who wish to call in by phone and to listen to a meeting or make comments. Some individuals may have signed up in advance to make comments. If there is anyone on the call who would like to make public comments who did not sign up, please press *3 on your phone now, and we will call on you using a portion of your phone number shortly. Additionally, Council President Hunt will be sharing a summary of any comments that have been emailed regarding tonight's agenda items. I will now take roll call. Council members in attendance, please say here when I call your name. Councilmember DiMichele?
Here.
Councilmember Goodman?
Here.
Councilmember Hall?
Here.
Council President Hunt?
Here.
Councilmember Martz?
Here.
Councilmember Walsh?
Here.
Great. All of our council members are present and accounted for. In addition, the following city staff and presenters are participating in tonight's meeting. We have City Administrator Wally Bobkovitz, Fire Chief Jeff Clark, Deputy City Clerk Tina Gieser. Other city staff may also be in attendance and on hand for questions. For those members of the public on the call, welcome. Meeting guidelines. Lastly, before we begin, I'd like to reiterate some of our meeting guidelines for all meeting attendants. Please speak clearly and pause frequently. State your name each time before you're speaking. Mute your microphone when not speaking. And if you're also streaming the live video feed, please turn the sound off as there is a delay. So the first item on the agenda would be public comment. Clerk, has anyone signed up to speak or indicated a desire to speak this evening?
No, no one signed up in advance to speak, and I don't see any members of the public on the call with us this evening.
Okay. Well, in that case, on the agenda this evening, we have two items. One is ID 70736, Eastside Fire and Rescue Governance Model Changes, presented by Jeff Clark, the Fire Chief. And we also have ID 0748, Eastside Fire and Rescue 2021-2022 budget, also presented by Chief Clark. If we do have any members of the public join us, we will be taking public comment at the completion of council questions after each agenda items. Just a reminder to the council, I'd like to limit our conversation to questions only before public comment, and then we'll have time to additional comments that the council would like to make. With that, I'm going to turn the meeting over to Chief Clark. Jeff, take it away.
All right, thank you. And it's nice to see everybody. Thank you for allowing me the opportunity to share this information with you. Thanks to Tisha's guidance and separate meeting with me this morning, I'm going to try to share my screen here. All credit goes to her. Any failure is me. All right, let me slide this over. And you should be seeing this, correct?
We have it.
Okay, thank you. All right, so first item that I have to discuss with you today is the converting to a nonprofit organization, and this is an item that we have been working on for several years. I'm sorry, I'm figuring out my PowerPoint. Here we go. For several years, and I am going to try with both of these presentations to be as brief as possible. You've received all of the information I'm presenting to you tonight in your packet, and I will leave as much time as you need for questions and answers afterwards. And hopefully that will be the more informative piece of this other than what was in the packet. So first of all, the overview on the governance model is simple. As we're put together right now, we're an ILA, interlocal agreement with the 5 partners. Some downsides to that ILA is that while it has worked well for 20 years, there are a few issues that I'll get to in a minute that need to be addressed in order to stabilize some of the long-term issues that can help out our long-term success as an agency. The agency started looking at this back in 2015, and there was some motivation behind the partners to want to move in the right direction, but it didn't seem like the state laws were caught up yet to really allow a fire department to become a nonprofit. At this time, there are no fire departments that are nonprofits in the state of Washington. In fact, I'm not aware of one anywhere. Other alternatives that were reviewed by the board included whether or not to form a regional fire authority, becoming one large fire district, or staying as an ILA, of course. And none of those seemed to work like the nonprofit. We referred this to the EFR board, referred it to the FAC back in the March timeframe, and FAC directed me to work with attorneys to draft some articles of incorporation and bylaws. We brought the attorneys to a meeting. We went through a few renditions of the documents that you had in your packet, and have worked through to the point where we took it back to the EFR board, and the EFR board recommended that each of our partner agencies be allowed to review the documents with your legal teams and provide any feedback before the EFR board makes a final recommendation. And that is exactly what we're doing today here in Issaquah. We're not asking for final approval from you. If the EFR board approves this, then it will come back to you at a later date for final approval. So there was a summary document that I'd encourage you to read if you haven't had a chance to read, which was dated April 13th, that was in your packet, that is informative as the changes of the ILA. One of the things that's vitally important to remember is that the ILA is the doctrine that we've been living under since 1999. And the strong intent of the partners going throughout this process was to maintain as much of the ILA as possible. Our intent was not to change the terms necessarily of what's in the ILA, but just to change what we had to in order to form into an entity that achieves the goals that we're trying to achieve. And the goals that we were trying to achieve were these 3 here. First, to share the liability for the employer of record. Currently, there is a mismatched liability that's put on Fire District 10. They are the employer of record. At the time of the formation of Eastside, they were by far the largest partner, and they were the largest financial contributor. Through annexations throughout the years, they are no longer the largest partner. There's three of you, Issaquah, Sammamish, and District 10, that are similar in size as far as what is paid. But D10 is no longer that partner, and right now 100% of the employee liability lies with District 10. And while they're in the contract, it does say that each partner is responsible for their share of the employment liability. There's nothing to mandate that couldn't get tied up in the courts and whatnot if there was a falling out of partners in the future. And really, the intent of the document all along has been that all partners share the liability among each other. So we wanted to shore that up. With that, we wanted to establish a joint entity that could actually own assets. As it sits right now, we technically do not own anything. The desk I'm sitting at, the chair I'm sitting in, is technically belongs to one of the partners. We are not allowed to title anything, and we're not allowed to own anything without being in a partner's name. And on some things, that's just fine. We have no intention of changing things like fire stations and fire apparatus. That'll continue to stay with the partners. I think that's an outstanding model to continue with. But on the other items within the organization that we transition through, every 3, 5, 7, 10 years, it doesn't make any sense to continue to name those in the name of a partner. If we can put that at the one central agency, which would be EFR, and EFR is responsible for those assets and booking those assets and moving things through. So that was goal number 2. And then goal number 3 was ensuring a stable environment for the employees and that they remain government employment. One of the things that derailed the nonprofit talk back in 2015 was a question on whether or not the employees could continue to belong to the public retirement programs that exist. Were they still public employees? And that was not entirely clear in the state law. That has since been rectified, and it is our attorneys produced a statement of record that states exactly how they're covered. And in fact, we have sat with our three union groups, and all agree and are comfortable with the fact that they can continue to stay with the benefits that they get now. And then lastly, as I've really already touched on this is the process that we're looking for right now. We have received comments from your attorney. In fact, the biggest comment had to do with liability, and I just heard back from our attorney today. There was a mismatch in the liability language between the Articles of Incorporation and the ILA. We are changing the draft Articles of Incorporation's liability or indemnification section to match what is in the ILA to get rid of that discrepancy. We've received various comments from each entity, basically what I would consider cleanup language from the attorneys. You are the last group that we have to receive comments back from, and the plan is to consider the nonprofit from the EFR board's perspective at our October 8th meeting, if there's nothing significant that needs to be explored. And then based on the EFR board's action, if they refer this back to you, then sometime over the next 3 months, I will be working with your city staff to get back on the city council for final approval. This will require the EFR board to approve it, and then each sub-entity to approve the formation of the nonprofit. If everything went as smooth as possible, we would anticipate implementing the nonprofit sometime towards the end of the first quarter in 2021. With that, I'll be happy to answer any questions that you may have on this subject.
Any question from the council? I'm waiting.
Wow.
Well, I know that Chief Clark did answer a number of questions that had been posed in emails. Thank you. Any additional questions for the chief regarding formation of the not-for-profit? All right, Chief Clark, you did an awesome job, apparently. So with that, we will move on to the next agenda item, which is the 2021-2022 Eastside Fire and Rescue budget.
All right, thank you. But I'm going to chalk it up to you and Councilmember Goodman. You must have been keeping the council advised through our process, so I appreciate it when the system works that well. All right, I'm going to attempt to share one more time. Here we go. All right, are you seeing this one? This one doesn't say share on it yet.
Yeah, we've got it. 2021-2022
Okay.
budget overview.
Good deal. It's working. Okay, so before I jump into the slides on this one, I want to state where we are and what exactly we're doing right now. So back in March, we started our internal budget process, and in June, the EFR board referred the budget to the FAC, the Finance and Administration Committee. Councilmember Goodman is a member of that committee, and in fact, Councilmember Ray did sit in on a couple of these discussions on the budget as well. And we've since had 3 meetings of the FAC, and just last week on September 23rd, the FAC made a referral of recommendations that I'll go over with on the last slide to the EFR board for consideration of the final budget adoption, which will take place on October 8th. The purpose of my presentation here is to simply provide you an overview of what we've done to this point. I'm going to provide you, like I have in previous years, the comparison data for Issaquah, and then I'm going to go over just at a high level what we did with the FAC. The slides that you received in your packet, I don't intend to go over every bullet with you. I gladly will go over any bullet or any item that you'd like to do a deeper dive on, but I don't want to bore you with things that were in your packet, but I will answer any questions you may have.
Hey, Chief Clark, I don't know if you intend this, but you're in kind of 2-slide mode on your what you're displaying.
Thank you. Tisha told me how to do this, and I failed her.
There you go.
That work?
There you go. That's
I'm still trying to figure out how can I see all of you? I got to expand that screen somehow. Now I can just see you, but she told me and I can't remember. Oh, well. So, yep.
This is Tisha. If you want to, you can drag out the corners of the video and should be able to see more of us.
There's all of my happy people. Look at them there. All right. Lindsay wins the happiest award right there. Okay. Thank you. That's better. So first of all, the comparisons that were in your table or in your packet These are comparisons that we've updated during every budget. The purpose of the type of comparison we do is just to get what is easily transferable and we can compare between entities. The purpose is not to show one better than the other. It's just to benchmark where we are in the community. And in my first year here, this was the tool that I used just to gauge where East Side Fire and Rescue sits in the market, just to understand, were we on the high side, staffing wise, budget wise. Coming in from another state, it's very difficult just to assess that just from coming in. So this is one of the tools, and the board at the time enjoyed it. So I have since included it in my updates with each of the agencies. So the reason that we compare budget to AV is because of the property tax-based nature of especially King County. Most of the fire department services, whether you're a fire district or an RFA, and yet a city, even a city as we look at it, we can boil it down to cost of operation per thousand as far as the budget goes. So that's the purpose of this. This is in the fire service here. This is kind of an apples to apples comparison. And when we're comparing operating budgets. Okay. But so what we're seeing here on this first slide continues to be true as it has been for the last 5 years, is that budget to AV, EFR continues when we're compared to all of the other large fire departments they basically serve more than one jurisdiction. They're either through contract or from an RFA or fire district. You can see where if we were a fire district, what our AV would be in order to provide the operation that we're doing now compared to where everybody else's AV is right now. Another comparison is cost per capita. Again, with those same group of fire departments, where are we? What does it cost per capita, which I think is pretty self-explanatory, to deliver the services that we are in this area. And then the last one is the FTE, so the number of employees that we have per thousand population, and what we have and compared to those same fire department agencies throughout King County, and then the largest in Snohomish and in Pierce. This takes the same data and simply breaks it down by our city partners and compares you now to all of the city fire departments, or all the fire departments that are in our zone. And our zone is simply a response area, which is north of I-90 and east of Seattle. Okay. And these are the jurisdictions that we work most often with. Same thing with FTE, with that same subset of zone 1. And same with cost per capita, well, within that zone. And then lastly, this is looking at King County for 3-station comparison. So these are communities that have 3 fire stations like Issaquah does, located within them, and what it costs them from an operations perspective to deliver it. You can see there's a wide range of costs for delivering these services, which on some levels can be quite eye-opening. Like, how in the world can it cost that much to deliver a very similar service? And there's lots of nuances to that, but this is always nice to gauge to see where we're at.
Hey, Jeff, I have a question from Councilmember Goodman.
Yes, go ahead.
Oh. Thank you. Stacy here. Chief, could you go back 2 or 3 slides? I think it was the comparison, the AVs of the cities.
This one here?
Yeah. Can you explain that a little bit more, please?
Yeah, so, yes, I will. I'll do my best. This would be basically if you were a property tax-based model. Because fire districts and RFAs, so predominantly the fire departments within actually the state of Washington, are funded through a property tax method. So they compare with AV. Basically, what does it cost per thousand of assessed valuation to deliver the service? Okay, so most fire districts have taxing authority of up to $1.50. They can implement a fire benefit charge like District 10 does to go above that $1.50, or they can ask for overrides to get above the $1.50. But most, if you're a volunteer fire department only, you can only go up to $1. So what you're seeing here are those agencies comparatively. So Shoreline, for instance, is a fire district. They operate on an AV program. They also have a fire benefit charge. It costs them $1.93 per thousand of evaluation in order to deliver that service in Shoreline. Issaquah is, if you were a property tax, if you were to take what you do today and transfer that to a property tax-based system, the budget to AV, we would be paying the equivalent of 65 cents I say we because I live here too in Issaquah.
So this is not saying that what we pay, our contribution to Eastside Fire, whatever that is does not, this is not saying that equates to 65 cents per thousand.
Yes, that is what it's saying.
That is what
Yeah,
it's saying.
This is taking what your operating cost is for your fire service, which is us. So your payment to us, and taking the AV in Issaquah, and it determines what that is. Yes, that's exactly what it's saying.
And when EFR is operating on 80 cents, that's
Yes.
That's because we have 5 different members, and so it's an average, or
That's blending it among everybody.
Okay.
So that's taking the AV of all 5 partners and the operating of all 5 partners to come up with 80. And then you and Sammamish specifically, and even North Bend. Well, North Bend's a little bit higher than the average, but you and Sammamish, because of your concentrated AV and your contribution of AV to the overall, then you come out a little better than that 80 cents.
I always learn something. Thank you.
You're welcome.
Great. Councilmember Walsh, I apologize. I missed your comment the first time. Go ahead.
No worries. This is Councilmember Walsh. Chief Clerk, my question's actually on that same slide as well.
Okay.
And that's my cat joining in. Can you explain why Issaquah, with a smaller population and a smaller total size than Sammamish, has a higher cost here when it comes to budget per AV?
So this is looking at total AV and then the budget, the operating budget that you pay. So as if we were going to raise those taxes from property taxes, okay, is basically what it's looking at. The reason is their AV is much higher than what Issaquah's is. Your cost of operation, I think, is within 400,000. We can check it a later slide, but I think you're within 400,000 of each other. But their AV is proportionally much higher, which is going to bring down their cost per thousand because they have more thousands in there. Does that make sense?
Yes.
So
I'm just trying to understand that from an understanding of our community, considering the number of businesses and, Costco headquarters and all of that for AV versus housing. But I guess it probably comes down to number.
it just, yeah, if I'm to go off memory, which is all I have, because unfortunately I don't have that data sitting in front of me, I want to say the AV in Sammamish is maybe in the $24 billion range, and you are in the 16-ish. So there's basically there's just a difference in the AV there. On the other side of things, if we were to look at the call volume and some of the other metrics that aren't included in this, you would see that you have a higher call volume and you have a more complex type of community because of the commercial use site, more apartments. You're more condensed, not as sprawled out as say Sammamish is. So, and of course they have a higher population. Most of their population is family. Your population's a little bit more mixed, and your population's also spread along the socioeconomic scale more than what Sammamish is. So there are lots of things to compare, and that's why we kind of pick out the ones that make the most sense, where it's easier to get the uniformity. So we're kind of comparing apples to apples.
Thank you.
Mm-hmm.
Councilmember Marks, you had a question.
Not going to leave.
Thank you, Council Deputy President. This is Councilmember Marks. I think you may have answered in the last 30 seconds of that answer. You may have answered my question.
Mm-hmm.
Do you have budget per capita for Sammamish and Issaquah in one of your charts instead of budget per AV?
This right here is budget per capita.
Okay.
Yep. On this one, there's 62,000 people in Sammamish roughly, and there's 34,000 in Issaquah. You're at 40, Stacy. I see you. So whatever number was, and what I do is I have a fire department guide that's published by the state chiefs every year, and I go to the same place for the AV data, the population data. That's where I draw it from. And so they have 20,000, 25,000 more residents than you do, and a very similar budget. So that's why their cost per capita is so much lower at this time.
So let me ask the question differently. First of all, let me not lose the forest for the trees. This is great. All these charts, your fiscal responsibility in EFR is really great, and these charts really show, and compared to other Northeast King County folks, what judicious stewards you are with our money. But again, to compare ourselves to our friends to the north, I got the per AV because, of course, Sammamish is the most affluent community in Washington State, so I get that. But it's not as obvious to me, given that we have a smaller population, why we wouldn't have a smaller expenditure. And you started to say at the end of your answer to Councilmember Walsh, but I want to understand a little better. You talked about socioeconomic spread, which I'm not sure why that would make a difference, and the nature of the calls.
Yeah. So, and again, I apologize, and I can certainly follow up with this, and we could do a deeper dive on that. Your call volume in comparison to Sammamish, again, I'm going to use round numbers. We have this in our board report every month, but your call volume is probably close to not quite 2 to 1, but you're significantly more call volume here than what they have in Sammamish. Sammamish is more of a bedroom style community where you have more of the mixed use. You have outdoor spaces, you have commercial and industry, you have the freeway running right through. So a lot of call generation areas in comparison to Sammamish. The formula that one of you asked me a question from that I followed up with, and I believe all of you received it, the funding formula, which is something that the board is wanting to discuss in the spring of 2021, is largely based on assessed valuation and call volume. So the funding formula, and the reason I brought up the slide that's on your screen right now to show what Sammamish and Issaquah pay, the difference between the two of you. The reason those numbers are based on AV and call volume in a very detailed comparison going down to the station level and parcel level, which is pretty complex, but that's where those numbers come from, where when we go back to this price per capita, this is simply taking what you pay and dividing by the population. And it comes up with a general number for us to do, again, to the best of our ability, an apples to apples comparison. Within the partnership ourselves, this is where we need to do a deeper dive on conversations about how do we split up that apple and how do we pay that apple. And, things like population or area covered are not in the formula. And I'm not advocating for that, but there are things that, for whatever reason, this formula predates, I think, everybody here, because it really goes all the way back to 1999. There's not a lot in the formula that's changed since 1999. But when they created it, they settled on these two metrics and their system. I've never seen anything like this from a formula standpoint. Like I said, it is very complex. And that also makes it, I heard it best phrased to me by the Sammamish city manager recently in a conversation, is it's a zero-sum game. If we do something to change the formula, there's still only 5 partners, someone's paying it, and anything you shift off of one is going to go to the other, which makes it a little dicey. The way to change it is, of course, if there was another partner who could come in, and that would be a nice synergy to change things. But right now, that climate just doesn't exist out there that we're aware of.
Thank you. That answered my question.
All right. You're welcome. Anything else before we move on?
I don't see any other questions, so let's move on.
Thank you. All right, next, I just want to get into, basically, I'm going to try to do the same overview that I gave the FAQ in a very condensed version. And I'm going to try to recognize that many of you aren't in our meetings. So if I use a term or something you're not used to, please stop me and I'll gladly clarify it. Revenue is where we're going to have some of the biggest changes that we've had in our budget. I'll do a deeper dive on the transport here in a second. The EMS levy, if you recall back in November, the King County residents renewed the King County EMS levy for Medic 1. From that levy, we receive just over $2 million a year. So we have that revenue coming in for the next 6 years, since that was a 6-year levy. That levy has been continuously approved since the early 70s. So it's a fairly stable source of revenue for us, and it's certainly stable for the next 5 years. EMS transport and GEMT, I'll get into in a later slide, a little bit deeper dive on that. Brycer Compliance Engine is a new revenue stream that we implemented last budget. It accounts for almost $20,000 worth of revenue. This is basically a system that helps us gain compliance from the business inspection systems that we do, and it clears up. It's basically each business pays a rate for somebody to come in and do their inspection, and this is a filing system, and Bricer stabilizes the collection and makes sure that we stay on time without having to send inspectors out all the time to maintain these things. The Snoqualmie Tribe is a contract that was negotiated in 2015. We provide services there. You'll see that that's been a fixed dollar amount. We are due to renegotiate that in 2022. And we actually started conversations with the tribe this past year about an escalator. There is an escalator in there, but it's kind of outdated because it's tied to AV. And AV, because they're a sovereign nation, AV is not assessed on their lands. So we were working through that. Then COVID hit. And obviously the tribe is hit. They were closed down for some time, so they're recuperating, and we'll start those conversations back up once we are post-COVID, or at least at a point where we can sit down and start having conversations. And then as a reminder, we'll get to end fund balance towards the end of the presentation as well. There are two policy directives that the EFR board adopted 5 years ago. One is to fully fund the liability reserve. This is a reserve that provides us some coverage for vacation and sick leave banks, as well as the costs of hiring new firefighters for the first 6 month transition period. And then fully funding our 10% operating fund contingency reserve. All right, so on revenue, this slide is a bit redundant with one of them that I provided to the FAC in a later slide, but I'll just take a minute to talk about EMS transports. And you'll see there was a significant increase in EMS transports. We actually started experiencing this increase in 2019. We implemented our first biennial budget for 19 and 20. And so in 2018, when we were planning this, GEMT, or the Ground Emergency Medical Transport Program, was just adopted by the state legislature. EFR enrolled as part of the first wave of agencies to enroll in this. This is a program that for public agencies to receive full reimbursement for the cost of actually delivering the service from all patients that are insured by Medicaid, right? Medicaid is the state version that is funded through the Medicare system nationally, but each state runs a Medicaid system. In Washington, we have the state Medicaid, and the state legislatures in previous to 2018, I think it was actually in 2016, approved the state law. It was implemented in 2018 through rulemaking. And we were taking a shot in the dark at what the revenue would be. So we actually didn't book the revenue, but we knew we would have some revenue coming in for the 19-20 budget year. When we got into 19, we found out through rulemaking that they were going to start paying us for services that were rendered in half of 17 and all of 18. And those were coming in as lump sum checks. So in the mid-biennium, we reported to the board the excess revenue that was coming in from this program. And it was decided, we addressed some needs in the mid-biennium, and then it was decided to hold the revenue for this budget process that we're in right now to decide what to do with what is essentially end fund balance as a result of the revenue. And now what you're seeing on this EMS transport line is we now have a year and a half of actual collections from the GEMT program, and what I am comfortable recommending that we can actually book as ongoing revenue from the GEMT program. And that while there is a small uptick in call volume that is represented in these numbers, the lion's share of these collections are coming from the GEMT program. Now, the GEMT program is a significant change. We charge right now $820 for a transport. The Medicaid program, GEMT, for every Medicaid patient we transport, we are charging, every year it changes a little bit, but we're basically charging $7,900 to the Medicaid system, which is the actual cost of the transport from a form that is filled out uniformly by everybody that is in this program and verified by the Washington State Healthcare Authority. We submit that annually in order to stay enrolled in the program. So ideally, we would be receiving what the actual cost of a transport is from all revenue sources, but Medicaid is the only one that's there now. What I said to the board early on about GEMT, my biggest concern about GEMT revenue source is that it is federally funded through the state, of course. But Washington, at the time that we adopted this in 2016, was the third or fourth state to adopt it in the nation. There's now more than a dozen states that have adopted this program. and it's continuing to climb. I don't know how stable this source will be in 3, 4, 5, 6, 7 years when there's 50 states collecting at this level compared to what Medicaid was paying out in the neighborhood of $220 a transport prior to this. So I've been assured by everybody I talked to, oh no, the funding's there. They know these programs are coming. But I am going to continue to have that on the back of my mind, and will continue to remind all of you about the potential instability of this funding as more states adopt it. And of course, the election will have a big deal to do with this based on the direction that the country takes on universal health care. And this all started with the adoption of Obamacare and changing in how medical transports are collected for agencies. And it can all change, of course, if there's a change in direction. But for the next 2 years, we're certainly comfortable with this. The GEMT line that you see there, we put a plug of $75,000 in 2018 to simply, we knew we were going to get GEMT revenue, but we had no way to gauge what that would be. We're not using that independent line, but I wanted to leave it in there so you could see why there was a change from 20 to 21. And now it's all rolled into actual transport collections. So long-winded, that will be my longest-winded description of the evening, I promise. But if there's any questions specifically on that, I'd be happy to answer them. All right, then, moving on. So this next one is, again, the reference in the box is what was recommended from the FAC to the board on October 18th. And this demonstrates the partner share of contributions in 21 and 22. I should have stated early on that the board gave me direction at the early onset of the budget that because of COVID-19 hitting, that we needed to keep the budget as flat as possible. There are I'm currently in negotiations for 3 CBAs, 2 of which are with arbitration eligible unions that I have been briefing the board with during in executive sessions monthly, and we will have a robust executive session in October. We don't have conclusion with those, so I basically have some plug numbers in these numbers right now, but what we asked to have adopted in October, of course, will be what we live by moving into 21 and 22. So, but there are a few question marks like collective bargaining, and there's still a few items out like L&I, some NORCOM fees that we don't know the exact dollar amounts, but again, we have a pretty good idea of what we're projecting. What you'll notice in these projections is the equipment replacement fund and the capital facilities fund. We are not asking the partners to fund, as I described to the FAC and it is in your packets. We have rebalanced the equipment replacement fund, and I'm fully satisfied that we have a 15-year balanced program and that we can do without contributions to that plan in 21 or 22. We will have to start those contributions back up in 23, but with the uncertainty of COVID and partners wanting to keep things flat so that you could take care of your other financial priorities while hopefully we climb out of whatever impacts COVID has, we can provide relief there. The capital facilities and maintenance fund, a little bit different outlook. Yep.
Hey, Jeff, we
Yes,
have a quick question from Councilmember DiMichele.
Oh,
Councilmember DiMichele?
thank you. Just what is a CBA?
Oh, I'm sorry, collective bargaining agreement with the unions. Yes.
Okay, thank you.
Thanks for keeping me honest. There I go, using my abbreviations again. The capital facility maintenance fund, a little different. We have a fund balance there. We assess the fund balance. We charted out the actual items that we have to address for the next 3 years. We have enough fund balance to handle that. The other thing in the capital facilities, when I was doing the review there has been a formulaic increase to that that's somewhat arbitrary. It's not really tied to any real projects. So when we come back in 23, there will have to be a requirement there, but it's going to be based on the actual projects we have to do, as opposed to there's basically been a number that's been growing by 3% for the past 20 years in that fund. And once we did a deeper dive, it wasn't actually tied to projects, which doesn't make much sense. So we took this as an opportunity to learn something else about ourselves. And when we come back in 23, that fund will look much different. But we'll get into that in 23. And then this is just another way of demonstrating. We've talked about revenue already, which is the non-partner revenue, which is down below. and the partner revenue comparison is above. This is a standard table that I've shown every year to the partners. All right, I discussed that our priority is to keep the budget flat and to maintain current service levels. I received a few questions from some of you and from some of our other partners about various programs. When I interpret a flat budget, I try to interpret that as we're going to do everything we can to maintain our critical services. It does not mean we're walking away from other programs that we're doing, but it does mean that we may not be able to handle them at the same level or the same pace that we were handling it if the budgets were to be able to be inflated to handle the costs that increase incrementally or some of the resources that we shift. So, I'll give a few examples of those on the next slide. You'll see, again, I'm not going to get into each one of these strategies unless you'd like me to expand on any of them, but these are some of the deeper dives that we did with the FAC to describe some of the issues that we see within these strategies. And they informed what we heard back from the FAC, informed what our final recommendation to the FAC and ultimately to the board would be. And these are a list of those programs that are listed as some things that I had on my list that in this budget year we would have liked to address in a different way than what we're able to now. And just to be fully informed on what we're kind of missing out on, I wanted to list some of those programs, and I'll highlight a few. First of all, I was asked specifically about the FireWise program. I was actually just up in Sammamish today meeting with 2 neighborhood associations about the FireWise program. I fully anticipate that we will continue to move forward with this. And what FireWise is a wildland prevention program. What do you do with your personal property to ensure that if we do have a wildland sweep through the area, that the property damage that your house sustains is minimized? And really the only way to control that is to have a program like FireWise and be advocating for it and informing citizens how they can properly fire protect their community. And on Labor Day, we had a double house fire up in Sammamish that started in a shed. It actually spread between 2 homes. One was a shake shingle roof, which is absolutely the worst type of roof you can have in a fire situation. The fire spreads very, very quickly from a shake shingle roof, makes it very hard for us to keep up with. And there was a tree that was touching both roof lines on the side of the fire at this on this property. The homeowners are highly motivated to see FireWise take off. And we also have some residents in Issaquah that we were meeting with pre-COVID and coordinating some meetings with that we had to put some larger meetings on hold because of COVID. We intend to continue those. But the level of FireWise coordination that I was hoping to get to, we will not be able to get to, but we'll continue to channel what staff resources we can to this program. It is of utmost importance to us, second only to our responsibilities. But of course, our responsibilities is where we need to continue. Our emergency response is where we need to continue to focus our energies.
Hey, Chief,
Yes,
Chief,
go
we
ahead.
have a question from Councilmember Martz.
All right.
Thank you, Council Deputy President. So I'm just wondering what more. I feel like there's more we should do on FireWise. This is a topic we've been talking about for a number of years. I remember vividly the state fire marshal a number of years ago saying Issaquah was the poster child for urban wildland interface fires, and I take that very seriously, living adjacent to a King County open space. But just to use my house for an example, I couldn't meet FireWise without cutting down a whole bunch of big trees, right?
Right.
FireWise, as it's written for the dry side, you can't fully do it here unless you're going to cut down a bunch of trees, and that's not going to happen for a number of reasons. So what can we do more to prepare ourselves? Every time in summer you hear about a house fire, evidently on this side of the pass, house fires are the leading cause of wildfires. On the other side of the pass, my understanding is it's lightning. But what can we do more, and how can Issaquah do more as a council?
Okay, so great question, and this is some dialogue I'd love to continue to keep having as the year goes on as well. There's a lot we can do, and I think first, on your first example of the trees, that is a head-to-head clash that is going to occur in all of our communities on this side. We don't want to take down trees, and it does clash with having a fire-safe community. How we maintain those trees, there's tremendous things we can do by keeping the tree limbs up, making sure that the ladder fuels the fuels below the tree cannot ladder up to the branch level, keeping bushes and garden vegetation away from our house in 30 feet. So there's a number of things we can do. Where things cost money when it comes to this is really the advocacy and the information and connecting people and groups. And that means staff to coordinate meetings, run meetings, HOA. I had a great conversation with Mayor Polly earlier in the year about doing basically cleanup days, but rather than having cleanup days, just have firefighters in several neighborhoods, have the city public works perhaps driving around with some of their larger trucks to help haul brush away and informing citizens how to clean up. But doing those cleanup days and really managing the forest is what is going to keep us from wildfire. As far as starts go, I would agree with house fires as a start. Car fires along the freeway here are what really concern us. There are a number of times each and every summer that we come up on a car accident on 90, anywhere along 90, and it's accompanied with a fire. And depending on how dry and how low the humidity is, that fire's already running up the hill. And those things highly concern me. But then think back just to a couple of weeks ago to Pierce County on the Bonnie Lake fire that occurred. On that afternoon, we had the perfect conditions on our side of the mountain as well. What they had was wind. For whatever reason, the wind did not come over to Issaquah, Sammamish, and North Bend. And the wind blew over power lines throughout the South King County and North Pierce County area and started a number of brush fires. Enumclaw, which is a small volunteer department, they have one engine. They are from 11 o'clock at night to 6 o'clock in the morning that night. They ran 23 brush fire calls because of down power lines. If we had a similar event in the Issaquah and Sammamish area, we would have had conditions that could have matched what happened in Bonnie Lake. And that spurred evacuations. There was quick action from the fire department, but they were still on that fire for 4 days before they called it contained. So it's those types of things that we need to stay informed about. We absolutely need to take action, and we're committed to doing that. We did apply for a federal grant and for $75,000 to help us with that outreach. We'll hear about that shortly. And we hope to have that in order to help implement some things moving into 21. But still, nothing will replace advocacy. And really looking for volunteers. Our CERT program here in Issaquah, we have a CERT program in Sammamish. HOAs and their boards are a wonderful place to actually start to advocate, inform, and instruct. And that's the kind of outreach that I think will really make a difference.
Thank you.
You're welcome. And anything else on that one?
No, I think that's it. Go ahead. Thank you, Chief.
Let's see. I know I received a question on the chaplain program, so I'll just expand on that one a bit too. Our chaplains are wonderful. We currently have 4 of them, and they receive about a $200 stipend a month to remain on call, and they do come out every time we call them. Our hope, we had a hope, and it'll still be a desire in a future budget, is to expand to another chaplain and to expand the stipends that they do receive for the work that they provide. We are incorporating the chaplains into the social working program that we are working in partnership with the Issaquah Food and Clothing Bank with. And that program will continue to develop into next year. So as we roll that out, there will be natural opportunities and maybe even some funding opportunities outside of our current funding resources to help us with that. But that's why the chaplain program is listed. And frankly, anytime I can list the chaplain program, I'd like to, because I want to make sure anytime you see one of them that you continue to thank them, because they are among the most dedicated and compassionate people I've come across in our community. And they do a tremendous job for all of us. Okay. And again, for purpose of your packet, I wanted to list some items for you that we will be working on. A couple of things to highlight that are Issaquah specific. This stems back from last year. We are locating a temporary Station 71 along East Lake Sam. We're still working on that, and we'll continue to work on that. The Mobile Integrated Healthcare Initiative, that was what I was just referring to with our partnership with Issaquah Food and Clothing Bank, working in the chaplains into that program. And then all efforts, in fact, I listened to the budget before, the efforts like the mayor is putting forward on the social working side, all integrating everything into the mobile integrated healthcare program is really what all the social work belongs to, and playing whatever role we can in that. We do receive some funding through the King County EMS levy for mobile integrated healthcare. And that is what we're working with the Issaquah Food and Clothing Bank. Those are the financial resources that we're getting from that in order to share in that community. So the majority of that work on the early side of things is occurring in Issaquah. It is our plan to expand it to our entire service area. But just because we had a willing partner at the Issaquah Food and Clothing Bank, Issaquah will be the beneficiary of the early part of the program that we've been working on for several months now.
Now, Chief, we got a question from Councilmember Walsh.
Yes, ma'am.
Thank you. This is Councilmember Walsh. Just looking through this list, you've got temporary station 71 and then the 2 stations in Sammamish, station 82 and 83. It's my understanding that the cities own the stations and thus pay for the additional station or the remodel. So you're including that in this slide, even though it isn't in your budget, it's just part of this particular cycle, correct?
That's correct. With one caveat I'd add to that, maintenance money that we have that you have funded in our maintenance fund, if there are programs that are tied into, like the 2 Sammamish stations right now, we have programmed dollars for upgrades in their HVAC systems and some other things in 21 and 22. If those dollars can be contributed, if they're going to do a remodel like they're proposing now, then we would also add back the community capital facilities maintenance money that was earmarked for those projects to help them get that project along. And 71, 82, and 83, the only budgetary requirement that we have is staffing. We tend to be asked to, and we're willing to do it, to actually coordinate the project. Once we cite it, while the city could fund it, we can perform the project management and take that burden off of the cities to ensure that we're coordinating. And that's the reason for putting it on here.
Perfect. Thank you.
Yep, you're welcome.
Hey, Chief Clark, I have a question. Can you talk a little bit about where we stand on Station 71, since it's got a year-end completion date and we're rapidly approaching that time?
Yeah, we're so in general, and when we know exactly, we'll certainly come out with more communication. We've had 2 sites now that we've cited and set along East Lake Sam that we've said those would be good, working with the city, of course, and we started to work through the process. And in both cases, there have been some extraordinary slides or along the side of the mountain issues with building that would either be cost prohibitive or just from the first site it just would not be sound to build in an actual mountain slide area. So while those have been disqualified, we're now getting down to trying to find a site and assessing our strategy on what we're actually going to do moving forward. Our strategy will probably not be a full-blown station now. It will be an aid station or something to that effect, but we're still working through the details of how that is. We are working as diligently as we can. It's just when we find the valuable land that there's not a lot of, and we hope, and then something comes up that disqualifies it. So that's kind of where we're at right now, is reassessing. And we have a couple of leads that we're pursuing right now. And we should be back to you shortly, within the next couple of months at the most, to let you know where we stand with that.
Great. Thank you, Jeff.
You're welcome. Okay, and my last slide is a summary of, again, this was what was in your packet, the 5 documents that were part of the packet that are sent to the EFR board on October 8th. The equipment replacement plan and capital facilities plan we went over. The operating revenue and expense fund was the summary of what the partners will be asked to pay if that's approved in that manner. And the 2 items I haven't talked about yet are the end fund balance strategy and the ambulance rate. The end fund balance strategy, again, that was in your packet, identified what our projected end fund balance will be and asked for an approval from the FAC, again, recommending to the EFR board on what to do with those funds. The largest part of that strategy, besides the items that are listed out, and I'll be happy to answer any of the questions you have on those if you do, is that what I'm asking for is that the remainder of the funds that are not earmarked would be earmarked in a fund for headquarters / training ground future needs. And at the time, I don't have the exact number, but it's 900 and some thousand projected right now. The reason for that is twofold. one, I had been evaluating for the 6 months prior to COVID, in preparation for our budget process, is what we're going to do about the building I'm sitting in right now, and that's our headquarters. We are talking with the Issaquah Food and Clothing Bank about a co-location and about possibly remodeling and doing some things here to integrate further into the community. An exciting project. At the time, we were talking about possibly relocating headquarters. That's not necessarily high on my priority list right now because we learned a lot about COVID, and what I did learn is we do not need the footprint we have now in order to effectively administer the fire department. So we're going to have some cost savings there, but with that comes some improvements. And since we have the money in the end fund balance, rather than ask at a future date, if we can be smart about saving that money for programs like HQ and what we do with it, and have some money that's available to the board. I do not have authority to spend that fund in the way that I'm proposing it until first coming to the board, and the board would have to specifically approve it for the project that is recommended. The other item is the training ground, which I've been talking to the board about all the way back through the last budget process. North Bend actually volunteered us some ground. Lonnie was still here at the time. And that piece of land has fallen through for environmental reasons. But what we were looking for is a flat piece of land in order to put some large training props to actually do some training at a site other than a parking lot or in our fire stations. And this would leave some money available for any potential project that comes up from there as well. There's no sense earmarking it, and I certainly don't have a specific budget ask at this time. But the strategy is to earmark some funds there that the board is in full control of for those future projects. And I do think the HQ project, especially with the Food and Clothing Bank, is something that is gaining some synergy. We're talking frequently about, and I think it's something that could hit over this next 2 years, and it would be nice to have those resources there. So that's probably the most significant thing about the end fund balance strategy. And then the ambulance rate, we had a significant conversation over the course of at least 2 meetings, and I really think it went into a third meeting on ambulance rates at the FAC. In the end, after educating everybody on what an ambulance rate is and what it's not, the agreement was that I would come forward with a recommendation on ambulance rate based on where we landed with the final budget. And so what I ended up recommending was that we raise our current rate of $820 to $1,050, which would generate about $208,000 more in revenue on an annual basis for the agency. If that ambulance rate is not approved, then we would have to shift that $208,000 to the partner revenue. And that's how it was explained. And essentially, and I would be happy to go into as much detail as you want on ambulance rates, but essentially what this rate increase means is that the large majority of this will be paid for by insurance companies, not by individuals. And it simply ensures that we get a higher rate. There is a term in ambulance rate collection called usual and customary rates. And as long as you're within those usual and customary rates, private insurance companies will pay those rates. Those usual and customary rates within King County are roughly $750 to $1,500. So we're within that rate. It is something that it is a fee that we have probably underutilized and underevaluated in previous years, and something that we should continue to look at moving forward on our annual, and we will through our annual budget process. So that's where that discussion came from. I'll be happy to answer any questions anyone has on this or any other part of the presentation.
Do we have any other questions for the chief? All right. I see a question from Council President Hunt.
Thank you. This is Council President Hunt. I did have a follow-up question on the ambulance rate. You mentioned the range and the upper ends of that range being 1,500. And so could you explain a bit more about how the amount was chosen for the increase? Oh. And then also I was looking a little bit, and it seems like some jurisdictions also charge a per mile. And so I wondered if that's also something that's considered, or if there are other considerations.
Thank you for your question. And the easy one first, we do charge a per mile rate. I believe it's $19.21. We're not changing that as part of this recommendation. So that wasn't part of the letter because we didn't have a change, but we do charge that. how we came to the rate. We had a lot of conversation about exactly that. How do we identify the rate? Where we settled on was that based on the request from the EFR board that we keep the budget as flat as possible, that I do everything I can to keep the budget as flat as possible. And when it came to partner contributions, if there was some amount of dollars that I needed in order to smooth that, this is how the approach I took, in order to keep those contributions down, then I was going to select a ambulance fee to fill that gap, which was at $208,000 or roughly $200,000, which is where I settled on $1,050. We did have conversation, and I had a recommendation 2 meetings ago where I talked about indexing it to what our actual cost of delivering the service is. There were pieces of that some of the FAC members felt were kind of arbitrary, and I certainly understood where they were coming from on that. And then even in the latest FAC meeting, there was a recommendation that we figure out how to index this fee to some other form of the fee, like what the private insurance companies are willing to pay, which is a number that's hard to ascertain. And I agree with that. I agree that long-term, trying to index it and identify it with something makes the most sense. But in light of where we're at in this budget process and the potential volatility of talking about this among partners, it's a hard thing to get uniform consensus around. It's a great topic to receive input. And it just came to a point where I had to make a suggestion based on what I felt our budget needed at this time. And that's where it came from this time. And we're going to continue to work on the indexing idea that one of the D10 commissioners mentioned in the 923 meeting.
Council
Okay.
President Hunt, that
Thank
answered
you.
the question?
That does answer that. And if I may, I do have one follow-up question also on fees.
Please.
So I also emailed a question, and thank you for the response regarding the motor vehicle accident fees. And so that would be expected to be, if it were collected, up to, I believe, $500,000.
Yes.
And I wondered what the plan is for that going forward, and additional information on the reasons why we may or may not be collecting that.
Absolutely. First of all, this is a fee that I absolutely believe we should find a way to collect. Especially of late, last year the legislature updated some RCWs that allow this fee to be more easily collected. We actually piloted this fee, I believe it was in 2018. We had set a 1-year pilot. There's really one company that does this right now called EF Recovery. And we entered into an agreement with them to do a 1-year pilot. Approximately 6 months into the pilot, well, let me back up. I want to say at the time, they were committing that they felt that our service area, based on our call volume, we would receive around $150,000 in revenue the way things were structured then. We got about 6 months into this pilot. We'd collected about $15,000, and the administration side of the interface that this company had was just very difficult to comprehend how in the world we were going to have a smooth, fair collection process, and it never manifested. So when the law changed this last year, I did bring the fee to the FAC as a consideration. I researched it, brought it back to the FAC, and my research tells me that we still don't have a third-party company, which would be required to collect this fee, that is proficient enough in the Washington, King County area to ensure that we could collect the fee in the way it was intended. The way things are written and the concept, I think, is sound. It's just a matter of finding a third party that would be capable and has a demonstrated track record in our area that they can live up to what they say we should be able to collect. Hopefully by our next budget cycle, this is something that will be available, and the private market out there will generate the companies that can do this for us. They just don't exist right now that we can find anyway.
Council President Hunt, did that answer your questions?
Yes, that does. Thank you.
Great. Councilmember DiMichele.
Thank you. Chief Clark, just back to the ambulance rate. If you pick up a person who is uninsured and truly indigent, is there a plan for what do you do in those cases? is the fee charged to that person at any rate, or is there a fund to help those people, or what happens when that situation arises?
So thank you for the question. Great question. And we did discuss this. First of all, currently, I have the ability and the authority to waive any fee, and we do exercise that when a hardship is shown, and we are compassionate in that step. We currently do not try to push any kind of hardship at all. The idea of establishing a fund, kind of a grant, is something that we did discuss with the FAC. We did not have time to develop that at this point for the budget, but that is something that we would still be able to develop in the months to come. And I think would be a sound way to handle it. Simply putting $100,000 aside, or some kind of grant where we can write to that for those individuals that would be eligible on the criteria. But it's developing the criteria in the process. But ultimately, still today, I have the authority, and we do exercise that to waive if necessary. We still have federal guidelines that we have to adhere to in the form of billing. So it doesn't necessarily mean someone won't get a bill, but we have the authority to waive the actual collection of those funds. But we have to bill in order to stay eligible in the other transport billing realms that we have to stay relevant in order to collect the fees from others.
Thank you.
Okay. Any other additional questions for the chief? All right. I see that Councilmember Goodman has a question.
Thank you, Councilmember Goodman here. So Chief Clark, I want to follow up on that a bit and make sure that I'm tracking correctly. So Councilmember DiMichelle's question is about whether we collect from people who can't afford to pay. So is this the same topic we've discussed at FAC a couple times about how hard we should try to collect from folks who are with their insurance is not paying, or are we talking about something different?
Well, I think it's linked. I interpreted the question as those with a hardship, and I jumped to the hardship clause. I think the middle conversation there that you're referring to is currently, to catch everybody up, we do not take people to collections. That was a board decision years and years ago. We did have a robust conversation around collections and taking people to collections. In fact, our billing company has asked that we retain a collection agency, and they believe that that would improve our collections. I would say the consensus, I don't think we ever voted on that, Councilmember Goodman, but the consensus is that we move in that direction. And that is a conversation that I need to have with the EFR board as a follow-up from the FAC about where to go with that. But right now, if you were to ask me my direction is to move towards a collection program based on what I've heard in the FAC, and that's what I intend to talk to the board about as we move forward. Does that answer the question you were trying to hit, Stacy?
Yeah, I just wanted to make sure that we close the loop, because I think if I wasn't, if I didn't attend the EFR meetings, I would be left with the impression that that we try to collect from everybody. And I think we have, maybe three different categories. One is we have folks who are insured and their insurance company pays. And then we have folks who insurance doesn't cover some or all of it. And those, everybody does receive a bill.
Yes.
But from my understanding is that we don't follow up and try to collect from anybody. We don't try to collect from estates. And so the question the FAC has been having is how far we push that. And just, in the interest of full disclosure, I've been pushing on this. That's nice that we don't want to force people to have to individually pay. That's a nice, and I understand that we're in a pandemic, and so I understand the reluctance to push that now. But it's a similar comment that I've had at city council meetings. It's not our money; it's the public's money. And so while the policy has been to be nice about it, that it is a good conversation that the FAC and the EFR board has been having. The separate question that Councilmember DiMichelle had is a subset of the people who don't have insurance and the insurance doesn't cover. And for those, then the subset is the people who can't afford it, who are indigent. And so that's the fund that we were talking about. But
Yes.
the middle part, we don't have a collections we don't have any kind of a hard collections policy. We don't try to collect very hard, and those bills are just written off, just so everybody knows.
Yes, and to clarify that further too, and I appreciate you bringing this up to make sure that we did cover it, is we contact we have a third-party company who does all of our ambulance billing for us. They contact everybody we transport 3 times for billing. And if they don't bill, after 3 times, if they don't collect, then they start the write-off procedure. And if they don't receive anything, then that's why we have the write-offs at every monthly board meeting. No matter what we do, even if we do collections, you're going to see a big list of write-offs. When you run a transport company, there's a tremendous list of write-offs that's going to happen. But the collection piece, both from our third-party administrator and from what our conversation in the FAC was, is a direction that we will be exploring moving forward, and we have to follow up and have the broader conversation at the EFR board. And I fully intend to bring that forward as we move process. It's just not linked directly to the budget process.
Thank you.
Welcome.
Any additional questions? Okay. Since there are no members of the public attending the meeting, we won't ask if there's anybody who would like to provide any comment, but I will ask Council President Hunt if we received any emails from the public relative to the Eastside Fire and Rescue budget.
Thank you. We did not receive any emails from the public on this item or on the previous item that Chief Clark presented on. Thank you.
Thank you. Any comments or feedback to Chief Clark on the topic? I see that Council President Hunt has a comment.
Yes, thank you. This is Council President Hunt. I had a few comments. One on wildfire and Firewise. I agree with Councilmember Martz that I'm interested in, making sure that people know what resources are available and how to prepare and how to reduce the risk of fire damage. So I think that's a really important topic. One thing I wanted to point out to any community members that are interested is that another resource that is available locally that does Firewise type programs very similar to a number of those that were mentioned by Chief Clark is also the King Conservation District. So if you go online to King Conservation District, they have a wildfire resiliency program, and they can do assessments for people's properties and things like that. So that's a resource that if community members are interested in preparing, that's just another way that they might explore those options. And my second comment is on the fees. I appreciate the information that was presented as well as the information that I received from Chief Clark in response to my email questions about the fees. I think in the future, it was indicated that in the future these will be revisited. The fee collection for a number of fees, the treat and refer fee, the motor vehicle accident fee, and then also the ambulance fee. And I think Councilmember Goodman said it very well. Ultimately, this is not our money, so I would be supportive of continuing trying to collect on these different fees. It seems like it adds up to a fair amount of money. So as we proceed with the next budgets, I would very much be supportive of continuing to try to collect those fees. And also, I think for me, better understanding the indexing of the ambulance fee, for example, so that we understand how we can make sure that we're covering costs based on the market in a methodical way, I think would be very useful, and it would also help me understand how those fees are calculated better. So thank you for the information, and I would be supportive of continuing to try to collect those different fees that we're not currently collecting.
Okay. Any other comments relative to the budget for this evening? I see a comment from Councilmember Goodman.
Thank you, Councilmember Goodman here. I just want to take an opportunity to thank Chief Clark for bringing his his dog and pony show to our council meeting. I really appreciate it. And just to say here publicly in front of all my friends on the council and anybody who happens to watch us again, that it's an honor and a delight to serve on the Eastside Fire and Rescue Board of Directors. Chief Clark is just a wonderful leader, very transparent, answers all of our questions, and it's much like the experience we've had tonight, a very open dialogue. And I just want to, again, thank you for all your service, and thank you for coming to our meeting, and thank you for making this budget understandable for us. Thanks so much.
You're very welcome. Thanks for the kind words.
Okay. Seeing no other comments, I'll take the last word this evening. And also, being an Eastside Fire and Rescue Board member, it is really a privilege to serve. And I think we saw from the early part of the budget discussion the value we get out of this collaboration with our partners in Eastside is really in the best interest of our city, and the leadership of both of Chief Clark and his deputies is really created an incredibly effective and organization that is, I dare say, beloved by our community too, which is pretty amazing to see. So any other comments or questions from the council? If not, I'm seeing nods. I'm going to say we have no more business, and this meeting is adjourned at 8:16 o'clock p.m. Thank you all, and have a great evening.